Okay, so at that, Alejandra is saying you are live streaming, already live streaming, but from ELS, not the event. Okay, so you are live there, but not from the event. Just give me a minute, I am joining that. Alejandra, can you share the link of the live? Alejandra, can you hear me?
Alejandra, are we
Is it?
now live in my personal channel?
Just give me, I'm looking into it. Just give me. So we are live on here. So if I go to
Are we streaming? Are we streaming in my personal one or any other channel?
yes, we are on the live stream on your uh, personal one. On
Okay.
your like the okay on the not on the personal on the account one.
Now we are streaming from where so that we can communicate with everybody that we are now live stream live. It should be live stream, but it's live streaming from where because we need to then send the
We are
link.
live streaming from Equal Language Access.
Okay, that's
I'm
the correct
sharing.
one.
I'm sharing the link with you, so you can.
I do I need the link or do they people need the link?
You people need the link. I can share
Right.
that link.
But
I
what
can.
I don't
I have shared
understand
that.
is okay. Okay. Finally, I think we solved the problem, Major. I think. Is it streaming?
Let me see. Yes, it's streaming,
Okay. Oh my God. I'm gonna
but we
resume.
can.
Okay, good. Apparently, we fixed the problem. Well, thank you everyone who stuck around. And if you didn't stick around, I'm gonna send this um, Zoom. I'm sorry, not this Zoom. This YouTube recording because I don't want you to miss anything. Okay. So for those of you who have been here with us since 1 o'clock, thank you so much. And I really appreciate that um, you had an interest in this topic. This topic is absolutely important, and we had issues with our technology, which comes to demonstrate how important technology is in our daily lives and then everything that we do, including language access, including training. So for thank you again for your patience. I'm very sorry for the inconveniences associated with not being able to live stream in the right channel. We made a mistake and we created the wrong links and etc. So if you're still here and I I'm gonna give you some information that's gonna be very valuable for you. And with that, um, I'm sure we can continue. Okay, this is what apparently happened. Something happened with the event link, and we were unable to stream from there. So we are asking everybody to join us on this stream. And I'm going to give a few minutes to see if people are able to join this new live stream or this stream from from our page because something happened with the direct event. I'm not sure exactly what happened. And so everybody is receiving a link and asked to join from that link because we had an issue. Okay, so we didn't start at 1. We ended up starting at 1:30. And my apologies. You have no idea how bad I feel. But the show must go on. We had advanced quite a little bit. So I'm going to back up and I'm just going to ask for confirmation that this is live somewhere and that people are able to get the link and join that live stream, the correct live stream, because apparently something is happening with the actual event, and we're not able to figure out what the problem is with our live stream. So we're sharing directly from the page, but not from the event. All right. So thanks for your patience, and let's go briefly about the questions I posted at the beginning, whether or not you're confident about your healthcare organizations meeting federal and accreditation standards for language access, and then whether or not your healthcare providers are satisfied with how you're dealing with the limited English proficient population, and also how they are actually, whether or not they are satisfied with your service. And if you have ever given it a thought about whether or not ad hoc interpretation was even acceptable for your operation. So, do you think language access is expensive? That's another constraint. And again, for those of you who don't know me, my name is Carol Velandia, and I'm the founder and CEO of Equal Access Language Services. Equal Access Language Services has the vision to prevent language based discrimination and the mission to help businesses and organizations become inclusive through language access. I also created an award winning curriculum titled Language as an Equalizer that became effective inclusion through language access, which won a Global Baltimore Teaching Fellow Award granted by the University of Maryland in 2020. I am a social worker, an interpreter, and an advocate for language access, language rights, and language justice. I was about the most annoying student, in fact, in my social work school, because I always ask about language access. And I have been done so for over a decade. I've worked with the intersection of health, law, and language. I became very passionate about this topic after I met Jose. Jose was a patient at the hospital where I worked for about 10 years. And his story really changed my life because Jose fled violence in Central America. His journey north was absolutely harrowing. First, he had to cling to the freight train known as La Bestia, and then crossing the Sonora Desert with a coyote. When he finally arrived in the US, he was detained and deported. But the danger back home was greater, so he came again, even though he was already deported once. Jose lived in poverty. He got sick, and one day he he showed up at the hospital where I worked, and I was interpreting for him. And of course, he had such a sigh of relief when I walked into the room. And his first word was like, "Oh, I'm so glad you're here." He told me his last appointment had been canceled because no interpreter was available, or they didn't call an interpreter on time. And so he had waited about 2 months, and of course that meant he lost wages, time, peace of mind, and he was told through me that he had a terminal illness and that it had all worsened because of the long wait. So Jose's stories really, really changed me deeply. It opened my eyes to the profound and often invisible impact that language access has on our health. It made me reflect on how vulnerable we become when we're sick, especially when we can't communicate in the dominant language. I thought about my own struggles with language and how important our health is and what it represents. And it made me realize that our health is our most important asset. There is nothing else that is as important as our health. Let's think about Jose, who fled everything in search for safety. But when he finally reached care, a language barrier put his life at risk all over again. But Jose is not alone in this tragedy. Jose is just one of over 25 million individuals in the United States with limited English proficiency. And that's not a small group, it's nearly 9% of our population. To put it in perspective, that's equivalent to the entire population of Australia and North Korea. And I believe I have a few maps here that show that. Here is the map of North Korea. That's nearly 9% of our population. And these individuals face significantly worse outcomes, greater risk, and system barriers to care, all because of one preventable factor, which is language. So, when we say we're committed to diversity, equity, and inclusion, but fail to implement language access, we're excluding a massive segment of our society. We are, in fact, discriminating against people simply because they weren't born here or because they speak another language. And this isn't just a moral failure, it's a civil rights violation. And beyond that, is a public health crisis. And why do I call it a public health crisis? Well, because patients are 4 times more likely to suffer adverse medical events, those who don't speak English. They are also spending more time at the hospital because they experience longer delays, longer lengths of stay, and also greater risks, and because they are not understanding discharge instructions. So there are plenty of misdiagnosis, medication errors, and in general, greater difficulties. And this is just the beginning of the problem. It turns out that our health represents, or healthcare in the United States is nearly 1/5 of the entire US economy, or 20% of the GDP. This is more than $4.5 trillion annually. And the troubling part is that a significant portion of that is simply wasteful or wasted. According to a study done by Berwick's in 2012 and Spear in 2020, the US healthcare system wastes hundreds of billions of dollars every year due to factors like overtreatment and administrative complexity, which means patients experience confusion, especially in individuals that don't speak the language. And granted, we have a fragmented system. So imagine coming from a small town in Honduras, for example, where you have perhaps a small building for healthcare, and then you come here to navigate this huge healthcare system that's very fragmented, where you have to go to one place to see the doctor, another place for your tests, etc. They were also attributing this wasteful spending to pricing failures, fraud, and failures of care coordination, duplicate tests, for example, missed appointments, which happens a lot in the limited English proficient population, many discharge errors, and all of these are preventable situations. And here is the kicker is that these estimates don't even include the financial devastation caused by the COVID-19 pandemic, which added an entire new layer of stress, inequity, and inefficiency, especially for multilingual and underserved communities. In other words, the waste was already catastrophic before the biggest health crisis of our lifetime. So, language access is not just an equity issue, it's definitely a fiscal imperative. Every communication failure is a missed opportunity for prevention and a gateway to costly harm. Investing in language access is investing in a smarter care, lower cost, and systems that actually work for everyone. So let's pause and define what we're talking about. What is language access? Language access simply means the provision of services like interpretation and translation that ensures that individuals with limited English proficiency, or LEP, can effectively communicate, understand, and be understood in critical settings like healthcare, legal services, education, government, right? We're focusing today just on healthcare, but language access applies to every aspect of public life. It's about removing language barriers to care, safety, and equity in healthcare, right? But just as healthcare institutions were making strides in language access, something significantly happened. And that was that in March 1st of 2025, Executive Order 14224 was issued by President Trump, and it declared English the official language of the United States. This order revoked Executive Order 13166, which for over 2 decades had required federal agencies to provide meaningful access for LEP individuals. So this was devastating because we were making good strides in the direction of providing meaningful access. So what are the changes? And I think this is one of the biggest motivations for people to join this webinar is what does what this executive order really means for healthcare, right? Well, this executive order introduced three major changes, each with far-reaching implications for millions of people across the country. The first change is that English designed as the official language, designated as the official language of the United States. And this is a country where we speak over 430 languages. So that is the first thing that this, the first implication of this law. This, for the first time in the US history, a federal executive order officially designates English as a national language. This symbolic change sends a powerful message about language identity in the United States, framing English as not just the dominant language, but the only language that institutions are expected to prioritize. The second impact of this is the revocation of Executive Order 13166. And this is perhaps the most impactful change of this order, because Executive Order 13166 had been placed in the since year 2000. So that earlier order required all federal agencies and organizations receiving federal funds to provide meaningful access to services for people with limited English proficiency. So this was the cornerstone of language rights enforcement in federal programs or federally funded programs. And by eliminating this order, Executive Order 14224 removes the federal mandate that guaranteed multilingual services across agencies. This creates a significant rollback of protections for limited English proficient individuals in healthcare, legal services, public benefits, and beyond. So the third implication of this is that now EO, or Executive Order 14224, shifts the responsibility of language access to the providers, right? To the agency. It is the discretion of the agency. So let me be clear, though. Executive Order 14224 does not ban language services. It removes the federal mandate, leaving the decision to offer them up to individual agencies, and this creates, or individual organizations, and this creates confusion and opens the door for inconsistency, gaps in access, and inequity, basically. And the critical part for you as healthcare provider and healthcare professional is that executive orders don't override federal law. This is very important for you to understand. Despite Executive Order 14224, we still have Title VI, which says that no person in the United States shall, on the ground of race, color, or national origin, be excluded from participating in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. So this law requires that all federally funded healthcare programs provide meaningful access to individuals with limited English proficiency. And failing to do so is not just a bad practice, but is also discrimination based on national origin. And of course, that is not legal. So even in the face of federal backpedaling, your responsibility as a healthcare provider hasn't changed. If anything, I believe now is time to double down. And now it's sort of like advocacy is all in your hands as well. So what protects, now that we have this Executive Order 14224, what protects patients? Well, thankfully, we have the Affordable Care Act, and specifically Section 1557 of this Affordable Care Act, because this um, this law, this Section 1557, is the civil rights backbone of the ACA, basically. It's the first federal law to broadly prohibit discrimination in healthcare on the basis of race, color, national origin, sex, age, or disability. It's very broad. And yes, that includes language barriers. Because under federal law, discrimination or discriminating, sorry, based on national origin, includes failing to provide meaningful access to individuals with limited English proficiency. So when a patient can't understand what their doctor is saying, or their sign consent form they can read, it's not just failure in communication, but it could also become a civil rights violation. So let's talk a little bit more about the Affordable Care Act, Section 1557, and that requires still meaningful access from organization. Um, Basically, who is affected by this law? So if you are serving patients, this is all about you. So hospitals, healthcare clinics, insurance companies, community health centers, telehealth programs, all of them are impacted by the Affordable Care Act. And they have an obligation to provide meaningful access to limited English proficient individuals. Let's break that down. That means providing interpretation and translation services that are timely and accurate, right? When needed. And this is important because I often see in my practice that language access and interpretation and translation services come as an afterthought or whenever is convenient, right? And now, like, patients can't wait or are not supposed to wait weeks for translated documents or guess their way through a diagnosis without an interpreter. The services must be accurate. The services that you provide has to be accurate and delivered by qualified professionals, not untrained staff or family members. This is super important because this is still happening in many healthcare services, that they get rid of the interpreter and use a family member, or that they never call an interpreter, and there is an emphasis on qualified interpreters. And the other aspect is that this has to be free of charge to the patient. Language services cannot be billed to the patient. End of the story. They cannot be billed to the patient. Just like you wouldn't charge extra for a wheelchair ramp or or elevator access, you can shift the cost of communication onto the person who needs it. This is just civil rights protection. And this this requirement has to be tailored to the needs of the population that you serve. So Section 1557 also recognizes that language access is not a one size fits all. You're expected to understand the demographics of your community and to adapt your services accordingly. So that means that different languages, formats, and delivery methods, from in-person interpreting to telehealth, captioning, or translating discharge instructions. In other words, you have to know your population, know their needs, and meet them. Because Section 1557 doesn't just tell us what we can do, it pushes us to build healthcare systems that listen, include, and empower. Let's talk about how we can do that effectively, sustainably, and with confidence. Next slide. So hospitals, clinics, and healthcare systems must step up where federal guidance has stepped back. Because without language access, there is no patient safety. So there is no equity, there is no justice, right? And these new regulations mandate constant training, right? This is where training comes in. Having a policy on language access is not enough. You need a complete workforce that understands it, applies it, and knows exactly how to recognize when language access is needed and how to respond appropriately. So here is the update when it comes to to training. You have to have training on how to provide these language assistance services, cultural competency, and identifying and working with limited English proficient individuals. And this is not only for frontline personnel. Everybody has to be trained in language access. Under the new 2024 regulations, language access training is no longer optional. And this is what's very important and the reason why I wanted to bring this workshop or this webinar. Healthcare entities are now required to provide ongoing training for all staff, right? And they need to focus on understanding language assistance services and all this, working effectively with interpreters, identifying the LEP community, and building cultural competence. This training also must be regular, documented, and updated because it's about embedding language equity into the DNA of your organization. It's about reinforcing compliance with Title VI, reducing risks, and ultimately supporting better outcomes and more equitable care. And if we want to take a closer look at what the training should include, this is going to be our next focus. First of all, what are the strategic benefits of language access training? Well, I'm sorry, I confused the screen. The first is that for sure, an inclusive workplace that prioritizes effective communication contribute to higher job satisfaction among healthcare providers. In fact, I was just reading a study that shows that when professional language services are available, providers experience less frustration and burnout. In fact, 78% of physicians reported that interpreters reduce total care time per patient, allowing for more efficient and effective care delivery. So this is an added value of any training on language access. And it also avoids preventable malpractice claims. We saw at the beginning how the cost of healthcare is up to the roof, and you don't want to have malpractice claims that come from lack of communication. So this is an added value of this. Also, accreditation bodies assess language access in general, and this training or language access training will support compliance with national class standards and also requirements like coming from the Joint Commission and other bodies. These standards emphasize the provision of culturally and linguistically appropriate services as means to advance health equity and improve quality of care. So that's an added value of being ready for language access. It also signals excellence in equity and patient care. So this is what my motivation was to create effective inclusion through language access 5 years ago, right? Is to help hospitals be ready and be compliant and tick all the boxes that they needed to continue to be accredited, because ultimately it is about reducing poor outcomes for limited English proficient population. So what is AIDLA, or Effective Inclusion Through Language Access? I created a 10-hour training program structured into 7 modules that combine self-paced online learning. And this approach ensures flexibility while maintaining engagement and depth of understanding. So I've been teaching effective inclusion through language access for 5 years. But the special thing about my course is that it's going to be fully online as of August 1st. And my course has a comprehensive curriculum The AILA program covers a broad spectrum of topics essential for fostering language inclusivity. For example, it covers legal standards, goes in depth about everything that we touch on today, right? Um, it also teach you how to implement certain strategy, practical approaches to integrating language access services into healthcare delivery. It teaches you how to work with interpreters and best practices for collaborating with professional interpreters, etc. It has CEUs for healthcare professionals and is designed to support compliance and improve outcomes for everybody. Um, so the one of the most important things, I'm sorry, I think I went too fast. One of the most important things about this training is the professional development aspect, because it's designed with healthcare professionals in mind. Participants can be eligible for continued education, and as a social worker, I'll tell you that I struggle every time to keep up with my CEUs, so it helps with that for nurses, for all professionals really in healthcare. It supports the ongoing professional development and commitment. So why do you think AILA is important? Because it definitely enhances compliance, aligns with federal mandates and accreditation standards, and reduces your legal risks. Improve patient outcomes, as I have said before, because it facilitates better understanding, adherence, and satisfaction among patients with limited English proficiency. And the workforce empowerment equips the staff with the confidence that they need to navigate language barriers effectively. It also promotes health equity because it demonstrates a commitment to inclusive care, fostering trust within diverse communities. So, as we conclude this is what I'm offering. This is my value proposition to all of you. It's something that you don't have to think about because I have done all the thinking for you for the past many years, and I have implemented this course for the past 5. But finally, is an updated course. It's an updated course as it was updated last in March of this year after the law change, after Executive Order 14224 was implemented. And it's there for you to take advantage of. So as we conclude, I want to invite you to think two about two things. One is the profound words of two vision. Well, I want you to think about these two sentences or two quotes. One is the one by Martin Luther King in 1966 when he was doing a press conference associated with the Medical Committee for Human Rights. He said, of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane because it often results in physical death, right? And then this stark truth underscores the critical importance of addressing disparities in healthcare, particularly those arising from language access. That's my focus. Then, many decades later, in her inaugural poem, The Hill We Climb, Amanda Gorman, our national laureate, reminded us that we have learned that quiet isn't always peace, and the norms and notions of what justice isn't always justice. Her words challenge us to question complacency and to recognize that true justice requires active, intentional efforts to dismantle systemic inequities. So these powerful statements resonate deeply with the mission of effective inclusion through language access. Effective inclusion through language access was created to equip healthcare institutions with the tools and knowledge necessary to ensure that every patient, regardless of language proficiency, receives safe, equitable, and compassionate care. So I would like to invite you to take the next step and join this vital endeavor. I would love for to see you one on one, all the people that are listening to this seminar. I would love to invite you to having a one-on-one 30-minute consultation where we can assess your current language access practices and provide tailored guidance to to enhance, your services. And we can also um, test or see what's working and what's not working at your institution. And this session will be available for everybody on August until August 1st. And August 1st is when we officially launch our online training. So this is the moment to act. This is a no cost opportunity available for a limited time. And because I believe together we can transform these ideals of justice into tangible actions that make a difference in the lives of those that we serve. So thank you for joining me today, and I look forward to meeting you one on one in person. And with that, I let you enjoy the rest of your afternoon. And I thank you again for your patience during these many challenges technologically with the live event. So I'll see you in the other side, as someone would say. Thank you.